Hi friends, once again welcome back to my channel Mukambika Nursing. Friends, daily we are discussing questions for ESIC exam preparation. Also these questions will helpful for your RRB exam, DSSSB, AIIMS NORCET exam. We can see the questions. First question, HIV virus was discovered in the year. Options, option A 1981, option B 1983, option C 1986, option D 1993. Question, HIV virus was discovered in the year. And the correct answer is option B 1983. And some additional points we can see. First case of HIV in India was reported in the year 1986 at Chennai. Okay, in India, first case of HIV in India at Chennai 1986. And first case of AIDS reported by WHO from Thailand in the year 1984. This is in all over the world. First case from Thailand reported in the year 1984 by WHO. National AIDS Control Program. NACP means National AIDS Control Program. Phase 1 started in the year 1992 and National AIDS Control Program Phase 2 started in the year 1991 to 1994. Phase 2 program in period 1991 to 2004 and Phase 3 2007 and Phase 4 the period is 2012 to 2017. This is also some important points regarding National AIDS Control Program years. Move on to the next question. After massive blood transfusion, a patient complains muscle spasm, tetany-like muscle spasm and rigidity in the extremities. These clinical findings indicate which electrolyte imbalance? Options, option A hyperkalemia, option B hypokalemia, option C hypocalcemia, option D hypercalcemia. Here the question is after massive blood transfusion. Massive blood transfusion means patient received more unit of blood, that is more than 10 units of blood. Okay, so that is massive blood transfusion. So after this massive blood transfusion, patient complains muscle spasm, tetany-like muscle spasm and rigidity in the extremities. This is the manifestation of which electrolyte imbalance? That is the question. The correct answer will come hypocalcemia. The manifestations of hypocalcemia is muscle spasm is there. The tetany-like symptoms. Tetany is one of the manifestation of hypocalcemia. So tetany-like symptoms, then muscle twitching, rigidity of the muscles and also painful cramp, especially in calf muscles. These all the manifestations of hypocalcemia. So here patient complains muscle spasm and rigidity. So it is the manifestation of hypocalcemia. And complications of this massive blood transfusion include hypothermia, coagulopathy, citrate toxicity, then electrolyte imbalance. Electrolyte imbalance especially hypocalcemia, hypomagnesemia, hypokalemia and also transfusion associated acute lung injury. These all the complications of massive blood transfusion. Move on to the next question. Principal components to prevent the infection chain linkage. Options, option A hand washing, option B wear mask, gloves and gown, option C wear apron, option D none of this. And the correct answer is the main principal component to prevent infection is hand washing. Option A is the correct answer. Hand hygiene is considered as the most effective and simple method to prevent infection from medical practitioner to the other person or patient. So nowadays hand hygiene is considered most important component to prevent infection in the hospital setup. Move on to the next question. A perception that occurs when a sensory stimulus is present but it is incorrectly perceived and misinterpreted is known as? Options, option A illusion, option B delusion, option C hallucination, option D delirium. The question is a stimulus is present in front of us but we are incorrectly perceived and misinterpreted as something else. That is known as illusion. Option A is the correct answer. One example I will tell, then we'll get the point easily. That is, one row in front of you. A rope is present in front of you, but you are perceiving as rope as a snake. That is misinterpreting or perceiving incorrectly. That is known as illusion. Option C, hallucination. Hallucination means perception in the absence of any stimulus. Okay, perceiving something by the person, but there is no stimuli in front of us. For example, there is nothing in front of you, but you can see a snake. Okay, nothing is there in front of us, but we are perceiving as a snake. That indicate it is hallucination. So this is the difference of illusion and hallucination. Move on to the next question. For the prevention of human rabies, immediate flushing and washing the wound with soap and water under running tap will be carried out for how much time? Options. Option A 2 minutes, option B 5 minutes, option C 3 minutes, option D 15 minutes. Here the question is to prevent human rabies, after the dog bite, how long we should wash the wound? Okay, so and the correct answer will go, it is 15 minutes. For 15 minutes we have to wash with running water and soap. Okay, answer is option D. After dog bite, we should wash the bitten area with soap and water. Most preferably we use running tap water. Okay, so we should wash the wound at least for 15 minutes. Move on to the next question. A trained dye covers a population of options. Option A 1000, option B 2000, option C 3000, option D 4000. Trained dye cover 1000 population. Option A is the correct answer. One trained dye for each village. Okay, and they cover this trained dye cover around 1000 population. Move on to the next question. A subcenter in hilly area covers to a population of options. Option A 1000, option B 2000, option C 3000 and option D 5000. A subcenter in hilly areas covers about 3000. Hilly, tribal and forest area covers 3000 population. And the subcenter in plain area covers about 5000 population. And we can see the other primary health centers. Primary health centers in plain area covers about 30,000 population. And tribal, hilly, forest area 20,000 population. This is in case of primary health centers. And community health centers in plain area covers about 1,20,000 population. In tribal, hilly, forest area, community health centers covers about 80,000 population. This is very important point. Move on to the next question. While changing the dressing, the nurse inspect the wound area become red, swelling and with induration. What is the possible complication? Options. Option A infection, option B dehiscence, option C evisceration, option D all of this. And the correct answer is, it is a sign of infection. The wound area become red, swelling and with induration. That is the sign of infection. Option A is the correct answer. Second option, wound dehiscence. Dehiscence means it is the separation of wound edge. That is before healing, the wound becomes separated. Okay, edge becomes separated. That is wound dehiscence. Wound evisceration means the internal organs are protruding out through the incisional area. That is wound evisceration. Move on to the next question. The test which is used to detect urobilinogen in urine is options. Option A Faucher's test, option B Eldridge test, option C modified Faucher's test and option D none of this. The test which is used to detect urobilinogen in urine is Eldridge test. Option B is the correct answer. And the first option Faucher's test which is used to detect bile salt in urine, and option C modified Faucher's test which is used to detect bile pigment in the urine. This test is modified Faucher's test, is also known as Mellin's test. Spelling GMELINS, Mellin's test, modified Faucher's test. Okay. Move on to the next question. Bright yellow color of urine is due to the presence of options. Option A pus, option B RBCs, option C multivitamins, option D salt. If you are taking multivitamin injection or multivitamin tablets, then the urine color will be bright yellow in nature. Okay, so the answer will come option C multivitamin. Bright yellow color of urine indicate the consumption of multivitamin, option C. Here we discuss some of the previous year questions, also important questions for exam. So surely these questions will helpful for your studies. If it is useful for your studies, please subscribe my channel and share my videos to your friend circle. In the next video, we can see next set of questions. Thank you for watching my channel.